Assalamu alaikum, this is Muhammad Mahir, and today we're going to talk about the parathyroid gland. So, what is the parathyroid gland? Uh, Actually, before I start this video, obviously, as I always say, please just treat this video as a background type of information video, something that you would watch before you start a lecture or right before the exam, right? Some sort of like a revision thing. Don't rely solely on this video to take every single information from it because it may or may not be 100% true, and that is something that I don't control because I'm still a human and a student as well, like a medical student or whatever, right? So yeah, the parathyroid gland, literally in the name, para means behind, right? So you have this thyroid gland, right? And behind it is something that we call the parathyroid gland. There are basically four glands, two superior, two inferior, lateral to the midline of the thyroid gland, and they secrete parathyroid hormones. Simple as that. Parathyroid gland, parathyroid hormone. And it helps with regulating the calcium levels in the blood, right? This is like the most important, like the main function of the parathyroid gland here. There's like a lot of like subdivided function for the parathyroid gland that we're gonna talk about later on. But it's mainly for the calcium levels. And so obviously four glands, kind of like peanut shape, I guess. Uh, Small. They don't look like the thyroid. I mean, they kind of look like the thyroid gland, which is why in thyroidectomy, which is basically the removal of the thyroid gland or the parathyroid gland, they can't tell uh, which part uh, which part is the thyroid gland or the parathyroid gland because they both look similar, right? And so this is why they have to like literally move a chunk of the parathyroid, chunk of the thyroid gland along with the parathyroid. Uh, that's for like some surgeries or whatever. Yeah, I guess that's a fun fact for you. Um, but regardless, this is the parathyroid gland, right? Uh, so they are like small oval shaped and yellowish brown bodies that makes parathyroid hormone, which helps with maintaining blood calcium levels in the blood by breaking down calcium in the bones and increasing blood calcium, which okay, so basically what it does is actually that's more of a physiology thing. I'm not going to talk about it right now. We're kind of like focusing on the anatomy here side here. uh yeah, the physiology, we're gonna get into that in a second. So the position of it, we just mentioned it, behind the thyroid. The blood supply here, it comes mainly from the inferior thyroid artery and the superior thyroid artery here. So obviously the inferior and superior kind of like merges like that, right? And it kind of like gives rise to the parathyroid or the superior parathyroid, I'm sorry, the inferior parathyroid artery here that supplies the inferior to inferior parathyroid glands here. And once it meets with the superior, the inferior thyroid artery meets with the superior parathyroid artery, it gives rise the superior parathyroid uh, vein. I'm sorry, the artery here, and this artery supplies obviously the superior side of the thyroid parathyroid gland, right? Obviously, this is a lateral view here, so in case you're confused a little bit, uh, yeah, basically is that superior side, inferior side. Superior is given rise by the superior thyroid artery. The inferior parathyroid artery comes from the inferior thyroid artery. Simple as that. Obviously, this is the trachea here and the pharynx. Okay, so a bit of function. How does the parathyroid hormone works, and what does the parathyroid gland do? The parathyroid gland secretes, as I said before, the parathyroid hormone. PTH for short. I'm just gonna call it PTH for now. But yeah, in case yeah, just to save time here. So basically, it makes PTH here. So what does PTH do? We're gonna get that in a second. So when you have low blood calcium here, too much little like calcium in your blood, which it happens. Why does it happen? Because it could be mainly because of the thyroid gland here producing calcitonin, which, by the way, helps with building up the bone, and that uses calcium, right? And when it does use calcium, it kind of uh, like it obviously stimulates the osteoclasts. Sorry, the osteoblast here, uh, and kind of like stimulates that these cells build more build more into the bone, right? And that uses up the calcium, which drives the calcium low. It also calcitonin also increases the secretion of calcium into the urine and increase the phosphate in the blood. Uh, but there are also like other factors like vitamin D, low intake of vitamin D may cause low calcium levels. And when that happens, it kind of like triggers the parathyroid glands here, one, two, three, four, to secrete the parathyroid hormone, PTH. Why does it produce PTH? Because there is low calcium levels in the blood. Just remember it that way. When there is so little calcium, PTH is produced. And what does PTH do? It does mainly two things here. I'd say mainly. And what are these two things? Uh, it kind of like inhibits the osteoblast from building up the bones and stimulates the osteoclasts to break down the bone. So it kind of like tells the body, hey, stop breaking down the bone. I mean, sorry, stop building the bone and start breaking it. And when it breaks it, calcium kind of like gets released into the blood. Just like that, break down calcium, calcium, calcium. Simple as that. So this is how it kind of like manages blood calcium here. What it also does is it kind of like it works as a hormone that stimulates the reabsorption of the calcium levels into the blood, thus calcium here, and secretes phosphate in trade of that um, that action or whatever. But it's also believed that it kind of like uh, help the kidney to stimulate alpha 1 alpha hydroxylase, which is important for the reabsorption of vitamin D in the blood. So what does vitamin D do? It basically helps with the reabsorption uh, of actually no, it kind of like helps with the management of calcium levels. Basically, kind of like increase it. I don't know exactly the physiology behind the vitamin D here, but all that you need to know is that more vitamin D in your blood, in your body, kind of like makes more calcium here because it's stimulated by this hormone here, and it drives up the calcium, right? So vitamin D can increase calcium levels. PTH is believed to uh, stimulates stimulates. Okay, just like how I said. So the absorption of calcium, secretion of the phosphate in the urine. Okay, uh, that's also that. And these three things here makes high levels of calcium in the blood, which is what the body needs. Like when there is low levels, you have to trade it off with high levels. That's how we fix it. And when you have a problem in one of these systems, something is gonna happen. What is that? Hyperthyroidism or hypothyroidism. So it's literally in the name. Sorry, it's hyperparathyroidism. I didn't say para here. I always I always miss the para thing, parapart or whatever. Sorry about that. So yeah, hyperparathyroidism and hypoparathyroidism. Hyperparathyroidism, literally in the name, hyper means high, high levels of PTH in the blood. What does it call? Like, what causes hyperparathyroidism here? It could be carcinoma on the thyroid glands, right? Obviously, carcinoma means more cells, and more cells means more parathyroid hormone. Could be adenoma, which is a benign tumor, I guess. Um, could be hyperplasia, an increased size of the cell that produces more parathyroid hormone. Could be an overstimulation, which is could be something like a secondary cause of parathyroid hormone. Could be like so. These are like mainly the three primary reasons to why uh, the parathyroid people get hyperparathyroidism here. So when they ask you like in the exam or whatever, like which of the following are a reason for a parathyroid, a primary reason for the parathyroid, sorry, the hyperparathyroidism here, and one of the answers could be like parathyroid carcinoma or or adenoma or whatever, or even hyperplasia here. Um, so what are the secondary causes here? It could be low vitamin D levels in the blood. You take like so little vitamin D, or you have like vitamin D deficiency. That's a secondary cause because vitamin D kind of like helps with the management, increases the calcium levels, and so when you have low vitamin D, then you have low calcium levels, and when you have low calcium levels, your uh, your body has to like uh, do something about it, right? This is why it increases the production of PTH, and PTH here, uh, when you have too much of it, then you have hyperparathyroidism, right? Could be a territory cause. Where is a territory cause? It's like a third cause here. Third English like that. Okay, so basically, could be because of kidney failure, right? So what is the kidney has to do with it? Well, the kidney produces, as I said before, alpha 1 hydroxylase, which helps with the absorption of vitamin D, which helps with increasing the calcium levels, right? See, one, two, three. When it's three steps, then it's a territory cause for hyperparathyroidism. Thus, kidney failure means uh, it can cause hyperparathyroidism. So, what does the hyperparathyroidism do in your body? Well, it does a lot of things. Mainly, it, it drives your calcium levels to abnormal high amounts, and that is bad for you because that's gonna cause hypercalcemia, and you don't want that in your body because it can cause heart and brain uh, interference or whatever. Uh, but it can also cause low levels of phosphate, of hypophosphatemia. So why hypophosphatemia? So remember when I said that it kind of like trades like the kidney, it trades calcium for potassium, Pa. I don't remember potassium, I guess, for in the urine or whatever. It kind of like it secretes potassium to increase the calcium in the body, right? So when you have too much PTH here, it kind of like it drives too much calcium into the body from the urine, right? And it's like it's not free, so it has to like use all the body's potassium and excrete it in the urine. This is why when you have like a patient, they normally have high amounts of potassium in their urine or whatever when you do like a urine test or whatever, and that could be like a symptom of hyperparathyroidism. So yeah, that's the kidney failure here. It can also cause a kidney stone. Why kidney stone? Well, simple, because too much calcium. Thus, calcium is a stone. It creates like a stone here, right? And it could cause bone pain and bone weakness. Why is that? As I said before, the physiology here. It's all about the physiology. When you break too much, when you have too much parathyroid hormone, you break the bone way too much, way too fast for the body to like build, like it too fast for the calcitonin to help with building it. Thus, your bones eh, start breaking down. It can easily get fractured. You can even it can even develop into rickets. It can like cause a lot of pain. Simple as that. Like it's just like it's very self-explanatory here. It can also make high levels of calcium absorption from the GIT, uh, high levels of vitamin D in your body, kind of like absorbing the vitamin D from the GIT here. And yeah, that's hyperparathyroidism. So what about the hypoparathyroidism here? Hypo means low, simple. Low parathyroid hormone, low PTH. What caused low PTH here? It could be simple as low like calcium intake here. You have too little calcium in your body, hypoparathyroidism. Uh, it could be because of autoimmune. Maybe you have like your I guess the immune system is like triggered and it's for some reason or another attacking the parathyroid glands, thus hyperparathyroidism. And it could be something about thyroidectomy. So thyroidectomy, as I said before, the removal of the thyroid or parathyroid hormones. Sorry, the parathyroid glands here. They usually only leave one here because yeah, they cannot save something for the body, but it can also cause hypoparathyroidism. Could be genetic, maybe like someone was like the fetus just grow up or didn't develop any parathyroid hormones. Sorry, the glands here. Could be because of medications. Because maybe like medication act like an inhibitor for uh, the glands here that reduces parathyroid hormone, and so it can also be caused by PTH resistance from like yeah, it's like hey, you have like the parathyroid hormone reducing PTH here. PTH like for some reason the osteoblasts, the osteoclast here uh doesn't like respond at all to like any PTH for a reason or another. Same thing with the kidney; it doesn't like respond with reabsorption of calcium from the urine here. And there is like another name to it. I'm gonna try to remember. It's called the Suku parathyroidism, something like that. It's Suku, Suku. Suku means similar here. So yeah, definitely keep that in mind. Suku, Suku hypoparathyroidism, Suku parahyperthyroidism. Suko means similar or like fake, something like that, I guess. So what does hypoparathyroidism do here? It can cause high levels of uh, hypercalcemia here, right? Hypercalcemia. Hmm. Wait a minute. Hypo hy, hyper. I'm pretty sure this is supposed to be hypocalcemia here. Yeah, sorry about that. So low uh low hypothyroidism means low levels of calcium here. It could cause like tendency. Tendency means like when you move your body too much, like it's kind of like a sudden movement because your nerve cells aren't exactly like functioning very well because there is low levels of calcium in your body. It could be it could cause like shortness, short body when you grow up or whatever. You don't get taller that easily, so thus you have like shorter bodies. You could have obesity. So why obesity? It has something to do with the growth hormone in your body, and obviously the growth hormone means it uses the glucose in your body, and kind of like when you have too much glucose and you have too much insulin, and insulin kind of like increases the lipid production in your body. It can also cause shortness for the fingers, mainly the fourth and fifth digit of your fingers here. Uh, Developmental delays, obviously. It can cause kidney stone. It can cause okay, kidney stone mainly because like phosphate, high levels of phosphate in your body can cause a phosphatic, I guess, stone or whatever. Uh, it can also cause high or should be hyperphosphatemia in your body. Hyperphosphatemia, yeah, that's how it works. So sorry about that one. Yeah, so this one is hyper and this one is hypo here. I should probably like change on that later on. But yeah, that's pretty much it. That's pretty much about the whole thing about hyper, and the physiology, pathology, medicine, and everything here. If you have any questions, obviously, I'm always here. Just ask me, and I'm very open to help you guys. If you need any explanation about anything, or if you feel like maybe I should explain those things in Arabic, I'm more than happy to do that for you guys. Uh, so yeah, I guess that's pretty much it. Have a good one.